Okay, guys, now we're going to talk about invasive hemodynamic monitoring. Now, some terminology you'll need to know: preload, afterload, cardiac output, cardiac index, and pretty much all the stuff you've seen before. Central venous pressure, pulmonary artery pressure, PAP, or pulmonary capillary wedge pressure. All right, systemic arterial pressure monitoring is done through an art line. Um, It measures systemic blood pressure. Normally, it's done via a catheter placed in the radial artery. It can be in the brachial or femoral artery, but greater risk of infection problems and bleeding problems. So most of the time, you're going to see it in the radial artery. Now, indications for art line: basically, they want to continuously monitor blood pressure. They also want to accurate monitoring for blood pressure. So that could be for shock, for vasoactive drugs, or hypertensive crisis. It's also used to do frequent blood draws, especially arterial blood gases. Now, contraindications for an art line: if the person has peripheral vascular disease, if they have any kind of hemorrhagic disorder, on the use of anticoagulants or thrombolytics, and also insertion site contraindications. So if there's any active areas of infection, synthetic grafts, or sites having prior vascular surgery, those things will contraindicate an art line. Nursing care for a patient with an art line: you want to do dressing after insertion, you want to immobilize the site, and you want to frequently monitor it every hour. Now, an art line usually is in the wrist, so you want to mobilize that hand so that they cannot bend their wrist, because the more that they bend that wrist, the more the art line is not going to be accurate. And that is usually what happens: is the art line loses its accuracy, loses its patency, and has to be removed after a while because of movement. And this is just another example of what an art line looks like, uh, how they secure it, and how they immobilize the arm using a board, wrist board. This is another look at the tubing and the setup that they use for an art line. Just take a look at that and be familiar with the different parts of it. Uh, and this is the waveform that you're usually going to see on a monitor. So these are usually hooked to a cardiac monitor, and this just shows the wavelength that you're going to see. Now, complications that you're going to see from an art line: thrombosis. They could develop a blood clot, blood loss, could have an air embolism or a thromboembolism, also a systemic infection. Um, they could have an arterial spasm at the site, develop a hematoma, and also we talked about inaccurate pressure readings, especially with movement. Now, introducing you to hemodynamic monitoring. Swan-Ganz catheter was introduced in the 70s. It was initially developed for the management of acute myocardial infarction. Now it's a widespread use in the management of a variety of critical illnesses and surgical procedures. Now, most of the time that you're going to see a Swan-Ganz cath used now, is usually for some type of open heart surgery, some type of a surgical intervention with the heart that they need to monitor the pressures on the heart. Um, just to show you how often it's used. I worked in a general ICU for 10 years and I saw one Swan scans catheter the whole time I was there. Now, if you work in a cardiac unit, you're probably going to see one every so often, one every couple of weeks, something like that. So any deficit or loss of cardiac function, such as acute MI, CHF, or cardiomyopathy, can be used for a Swan scans. There's all types of shock, cardiogenic, neurogenic, and anaphylactic. Also, sometimes these are used for decreased urine output from dehydration, hemorrhage, GI bleed, burns, and surgeries. Purposes of any kind of invasive hemodynamic monitoring is early detection, identification, and treatment of life-threatening conditions such as heart failure, cardiac tamponade. They also are used to evaluate the patient's immediate response to treatment, such as drugs and mechanical support to guide therapy. And also used to evaluate the effectiveness of cardiac function as looking at cardiac output in the cardiac index. Now, values obtained from pulmonary catheters. You have your CVP, central venous pressure or right arterial pressure, your pulmonary artery pressure, which is your PAP, your pulmonary artery capillary wedge pressure, or PAWP or PCWP, and then your cardiac output and your SVO2. Now your CO2, remember, to get your cardiac output, you're going to take your stroke volume times your heart rate, and that should come out to 4 to 7 liters per minute. Now your stroke volume normal is 50 to 100 milliliters per beat. Your right ventricle and left ventricle eject the same amount of blood, and determinants of your stroke volume are going to be your preload, your afterload, and your contractility. Now, preload is the volume of blood in the ventricle at the time of diastole, just before the ventricle contracts. Preload is of your right ventricle measured indirectly by the CVP. Your preload of your left ventricle is measured indirectly by the PAWP, and afterload is measured by calculating the SVR and the PVR. Now, to find your cardiac index, you're going to take your cardiac output, you're going to divide it by your BMI. Your pulmonary vascular resistance is going to be your mean PAP minus your PCWP times 80 divided by your cardiac output. And your systemic vascular resistance is going to be your MAP, mean arterial pressure, minus your central venous pressure times 80 divided by your cardiac output. You need to know these formulas. Okay, you might see them again. Now, it's a closed cardiovascular system, and this just shows how that the everything is inserted. Now we'll go over your different components of your pulmonary arterial catheter. Okay, this is a closer look at it. Your different ports, your balloon inflation port, thermometer port, your proximal lumen, your distal lumen, and then your regular lumen. And this gives you a description of everything if you'll read through those. Um, it does have an inflation balloon that they will put in, and just read through these, and it gives you an idea of what each thing will do. Now, normally, the pulmonary arterial artery catheter has 3 to 4 ports, and usually one connection pigtail for temperature or measuring cardiac output. Your proximal port or your blue port is used to measure central venous pressure, and that's divided by your right arterial pressure, and to inject port for measurement of cardiac output. Now, your infusion port is white, and it's used for fluid infusion. Your distal port is yellow, used to measure your pulmonary artery pressure. And the balloon port is red, and it's used to determine the pulmonary wedge pressure. And they have a 1.5 milliliter special syringe that's connected to that. Now, your blue port used to measure your central venous pressure and right arterial pressure. It's also an inject port for measurement of cardiac output. Your normal value of your CAP or your right arterial pressure is 1 to 8. Elevated CVP can occur with right ventricular failure, and decreased CVP can occur with hypovolemia. Now, a lot of times in the hospital, you're going to see docs use this CVP reading to tell whether their patient is either too wet or too dry. And so they'll adjust their fluids based on their CVP reading. Now, the infusion port is white, is used for infusion of IV fluids, also for giving medications centrally, through the heart. Is essential to getting it in there quickly. That goes in the circulation system, the circulatory system, a lot quicker. Now, your yellow port, your distal port, is at the very end of the catheter. It's used to measure pulmonary artery pressure. And your PAP ranges from 15 to 26 systolic, 5 to 15 diastolic. And your mean pressure is about 15. So causes now, when a balloon is inflated, the catheter in the yellow port, the catheter wedges in the pulmonary artery, which then senses the left arterial pressure and left ventricular and diastolic pressure. Now, your normal value is 4 to 12, and this must be measured at the end of expiration. Your red balloon port is used to determine pulmonary wedge pressure. Like we said, there's a 1.5 ml special syringe that's connected to the end to prevent overinflation of the balloon. You must always remove the air from the balloon after completing the measurement. Your temperature pigtail is basically used to measure core temperature. It's used in the measurement of cardiac output also. And this just shows you the components of the PAP monitoring system, how it's hooked up. Now, components of the monitoring system, there's going to have a bedside monitor. It's going to be the amplifier is located inside, and the amplifier basically increases the size of the signal. The transducer also changes the mechanical energy or pressures of the pulse into electrical energy, and should the level should be with the flubastatic axis. And you can estimate this by intersecting the lines from the fourth intercostal space and the mid-axillary line. And then also you'll have the recorder. So your phlebistatic axis, is marked on the patient's chest and the anatomical point of origin for the hemodynamic pressures that are being measured. Now this is just a picture of them leveling the transducer with the patient to make sure that they're accurately monitored. Now when you do this, you have to have the bed flat and the patient has to be flat. This is just another picture that shows the insertion of a pulmonary catheter, where it goes, how they insert that. Now, a lot of places now have a guide, have a little machine that will show them as they're inserting where the catheter is actually going, so they know that it is in the right place. Otherwise, they'll have to take a X-ray to find out, to make sure it's in the correct place. Now, when a patient is going to have this done, you need to inform the patient of the procedure. Of course, you're going to have to get an informed consent form signed by them for the procedure. You're also going to need to set up the pressure system per the institutional policy. Have it set up for the doctor. Once the doctor inserts this, you're going to flush all the ports of the pulmonary catheter and set up for the infusions. You're also going to establish the phlebistatic point. You're going to zero the system, and you're going to assist the physician as necessary. So a lot of times in the ICU, they will put this in at bedside. Now the insertion is going to be into the large vein, usually the interjugular or the subclavian, via introducer. The catheter is then threaded through the introducer into the right atrium, and once the right atrium, the balloon is inflated and the catheter advances with the flow of blood through the tricuspid valve into the right ventricle, past the pulmonic into the pulmonary artery. Complications that you're going to see with this type of line: infections can occur. So you're going to do meticulous line care, make sure that that dressing is changed out, that it's done the correct way. You're looking for bleed back and bleeding at the insertion site. These catheters can also cause PEs or an embolism, and so you're going to watch for any signs or symptoms of them having some type of a PE or air embolism. They can also have pulmonary infarction. It has been known to rupture the pulmonary artery, and it can cause ventricular dysrhythmias. So all these things need to be watched for with this line. It is an invasive procedure. Infections is probably one of the biggest things that you're going to see that can be caused by this, and so meticulous line care is essential. So anytime that it is touched, it needs to be wiped down. Anytime it's used, it's a sterile procedure for the dressing change, and that needs to be specifically watched and maintained. So that's it for all the videos right now, and good luck with cardiac.